Heart failure and acute pulmonary edema, respiratory distress. Differential diagnosis. Please view this video prior to watching this PowerPoint. Prefixes and suffixes are really important when you're looking at causes of conditions and conditions. So if you look at the prefix AER, you can expect air or gas, and same thing with the suffixes. You'll want to keep this list somewhere close by so that you guys can refer back to it when you're in other courses such as preclinic and pharmacology. Okay? But a lot of these you guys already know. Let's see here, cardio, heart. Hypo means below normal, hyper means above or too much, and then emia, blood, myopathy, muscle disease. So you guys should be pretty familiar with these already. Okay, key terms to know for this PowerPoint: heart failure versus congestive heart failure, acute pulmonary edema, dyspnea, coronary edema, cardiac dysfunction, dysrhythmias, ischemia, functional capacity, hyperperfused or congestion, and hypoperfused, which is ischemic, hypoxia, and arteriosclerosis, along with cardiomyopathy, disease of the heart muscles, right? Because we're looking at myopathy. The heart. The heart's a pump that supplies blood to all organs and tissues and contains oxygen and nutrients. It's vulnerable to a variety of disorders, which can be congenital, metabolic, inflammatory, or degenerative. It manifests clinically in two ways. One, directly with chest pains and palpitations, such as a myocardial infarction and dysrhythmias. So going back to what we already know, if that patient is having angina, we need to differentiate between if it's a myocardial infarction or angina, and then they would take their medication. Then we have indirectly, and that's in other organs that are hyperperfused or hypoperfused, congested or too much, and ischemic or too little. The inability of the heart to supply sufficient oxygenated blood for the body's needs, it is a condition. This is heart failure. Characterized by dyspnea, okay, abnormal bleeding, and fatigue and signs of edema, and that means edema on the extremities oftentimes. A complex syndrome that can result from any structural or functional cardiac disorder that impairs the ventricle to fill with or eject blood. So common causes would be coronary artery disease, high blood pressure, notice there's an asterisk there, and diabetes. Now you want to know the differences and how the left ventricular heart failure differentiates from the right ventricular heart failure. So signs and symptoms related to congestion of the pulmonary vasculature, congestion in lungs from pressure within left ventricle, weakness and fatigue. All right, see how this is has an asterisk here. Acute pulmonary edema is the most dramatic symptom of left heart failure. The onset is usually acute with a slight dry cough, extreme breathing difficulty or dyspnea, and feeling of suffocation, especially when in the supine position. So we don't want to lay our patient back, right? We want to sit our patient up. So this patient would be more in the semi-supine position. And this increases with fright and apprehension, which leads to an increased heart rate and blood pressure. So the clinical manifestations of left ventricular heart failure are associated primarily with respiratory distress. So if they're leaning back, they get that feeling of suffocation, and then difficulty breathing, which is called dyspnea, right? The weakness and undue fatigue are usually the first symptoms of the patient with left ventricular heart failure. You need to know those for your exam. All right, now we have right ventricular heart failure, and this usually develops after left ventricular heart failure. Systemic venous and capillary congestion predominate, which leads the tissues to swell. So we're seeing edema in those feet and ankles and lower legs. So that is your sign that there's right ventricular heart failure, would be edema. And this is usually treated with a drug called diuretics, and a drug that you guys probably may not even realize that you're taking would be coffee. Coffee is a diuretic and will help reduce some of that edema. But there is prescription medications such as Lasix that can help drain some of that fluid from the extremities. Heart failure signs and symptoms. The most common sign and symptoms of heart failure are shortness of breath or trouble breathing. Again, we're talking about the heart failure, and it usually starts on that left side. That's the side that's affected the most. And it's weakness and fatigue with respiratory distress. Shortness of breath, trouble breathing, fatigue, swelling in the ankles. This is when it starts to go to the right side. Feet, legs, abdomen, and veins in the neck. Vitals include usually increased in blood pressure, respirations, pulse, and weight. So if you're creating that chart that we talked about in class, you can include these signs in the vitals. Heart failure, a group of signs and symptoms with varying degrees among individuals. All patients with heart failure are at an increased risk during dental treatment. So we want to evaluate the patients prior to starting treatment. Then we're going to modify our treatment as needed and be prepared to manage the needs of the patient. Okay, so again, if you're filling out your form for age of the patient with heart failure, you can see that in general, men and women are pretty much the same until we get to that 55 to 64-year-old range. So from 55 really to 74, men are primarily affected by this. Then it evens out again around the age of 75. Approximately 5 million Americans have heart failure. The prevalence of heart failure increases with age. So you need to know that. They increase with age. Prognosis, once diagnosed, is poor. According to Framingham Heart Study, 80% of men and 70% of women younger than 65 years of age will die within 8 years. In those diagnosed with heart failure, sudden cardiac death occurs 6 to 9 times the rate of the general population. Okay, and remember, because they are so sick, they are at an increased risk with dental treatment. Predisposing factors, hypertension. Our high blood pressure is responsible for more than 75% of all cases of heart failure. Let me circle that here for you. You want to know that number. Coronary artery disease or myocardial infarction is another predisposing factor. Diabetes, and then we have other factors that maybe aren't as prevalent, and that is pregnancy, hyperthyroidism, anemia, Paget's disease, which is of the bones. So there's a video here for you guys to view preventing heart failure. Please make sure you watch all these videos, okay? It's going to help kind of bring things home for you. So again, what is heart failure? It's an excess of serous fluid in the alveolar spaces. That's what's causing that edema on the right side. The risk factors for heart disease that you cannot change include age. We're all getting older, right? By the second. Your gender, your genes, and your race. Heart disease in women. According to the American Heart Association, cardiovascular disease is the leading killer of women over the age of 25. Early signs include women maybe have warning signs that are ignored for weeks or months, and sometimes doctors don't recognize them because they are different from the male counterparts, which is where most of the research had been done. Men most often have the classic heart attack signs, which is tightness in the chest, arm pain, and shortness of breath. Women's symptoms resemble those of men. However, women may also complain of nauseousness, fatigue, indigestion, anxiety, and dizziness. Functional classifications or capacity, we have class 1, which is no limitations. Class 2 would be slight limitations of physical activity. So comfortable at rest, physical activities result in fatigue or palpitation, dyspnea, or angina. Then we start to get a little more serious, which is the class 3, which is marked by limitation of physical activity. They're comfortable at rest, but easily compromised with slight activities. Then we have class 4 is the inability to carry on any physical activity without discomfort. So this is kind of a funny little cartoon about ASA classifications, and this is how we can remember it with heart failure. We have our ASA 1, which they can make it to the top of the stairs and still keep going. And then 2, they can make it to the top of the stairs, but they're just still a little exhausted. 3, they can't quite make it all the way up. 4, they're incapacitated. And 5, of course, they aren't expected to live within 24 hours. So when we have a class 2 ASA, we're looking at just reducing the patient's stress. Again, not just nitrous, but as Dr. Marcel said, some nice calming music and just making sure that your patient is comfortable. Then our ASA 3, med consult prior to dental treatment. And then 4, as always, we are only administering dental care that's necessary at the time, no elective care there. So stress reduction protocol and treatment modifications, supplemental oxygen is always a good idea, but you're only going to use about 3 to 5 liters per minute, and we'll talk about that more in pain management and in pharmacology. And then chair positioning, remember, don't sit them back very far, and that's orthopenia. Med history and dialogue history. You want to ask your patient, have you experienced, do you have, or have you had? And then you want to start to get into the drug therapies. Are they taking their diuretics? Are they taking any vasodilators? So again, we're going to go through this in pharmacology also, but I want you to start thinking about what these are. And once heart failure has been established, the dialogue history would include, can you carry out normal activities? This is going to help you with your ASA classifications. Can you climb a flight of stairs? Do you use more than 2 pillows to sleep? Are they having to sit up when they're sleeping? That would indicate the left heart failure, left ventricular heart failure. So here's our management. First, we want to recognize the problem with the conscious patient with dyspnea. You're going to discontinue treatment, sit your patient upright, and then you're going to activate the dental team and EMS. And then you're going to implement your stress reduction protocol. So administer oxygen. Here we're going to pump it up a little bit more because they aren't getting enough with their dyspnea. We're going to monitor our vitals again every 5 minutes. This doesn't change between emergencies, right? We're always doing it every 5 minutes. And we're recording them, right, for the paramedics. Alleviate the symptoms of respiratory distress, and that is done by the EMTs and at the hospital. And then, if possible, administer a vasodilator such as nitroglycerin if the systolic blood pressure reading is greater than 90. Alleviate any apprehension, and here it says morphine. Of course, we aren't giving that in the dental office. And in the future, we want to make sure that the patient is managed properly, sitting them up, giving them something for anxiety, administering oxygen throughout the appointment to keep them comfortable. So for subsequent treatment, we also want to get a med consult to make sure that the patient is okay to be in our chair and there won't be a medical emergency, hopefully. Again, stress reduction protocol and oxygen. And here is a risk test that people can take on WebMD, and we will give 5 participation points if you complete this by the beginning of class next Monday. I won't be announcing this on Blackboard. This is a treat for those of you who listen to the PowerPoint. Respiratory distress, differential diagnosis. Question, all those follow-up questions on the medical history, right? And then we're looking at age. Are they under the age of 10? Usually it's asthma. 12 to 40, especially if it's men, you're going to look at hyperventilation. And then older men, 50 to 60, and women 60 to 70, typically it's going to be heart failure. Gender, heart failure incidence is slightly higher in men, but again at that 75-year-old range and above, it's equal for men and women, okay? Differential diagnosis continued. Physiologic and psychological stress. With all of them, you want to implement your stress reduction protocol. And all of them can be triggered by stress. So we're looking at hyperventilation is due to stress, asthma can be induced by stress. Heart failure can be exacerbated or symptoms can worsen under stress. So always keeping that in mind. Clinical symptoms between acute episodes may exhibit signs and symptoms at all times, so they may have asthma anytime, right? But then we want to think about our orthopenia, how we're sitting the patient up, and that's going to be dependent on their edema and peripheral cyanosis, dyspnea, and undue fatigue that they may show during treatment. So if they are showing it, sit them up, get them comfortable. And I do want you to note that cyanosis is recognized in the heart failure patient. That's that turning blue, those blue lips, right? And then peripheral cyanosis would be like the fingertips and the toes. Position patient in supine position increases the symptoms. So you don't want to be positioning your patient in supine. This is the one time, of course they're conscious, so you still want them to sit up anyway, right? We're making our patient comfortable. Especially with the heart failure patient, make sure that they're seated up throughout the dental appointment. Accompanying sounds, asthma, you're going to hear a wheeze. With heart failure, you hear that moist, wet respirations, especially with the acute pulmonary edema. Hyperventilation, it's deeper and more rapid breaths, but no sounds. Symptoms associated with respiratory distress, shortness of breath, increases with patients with heart failure. And during hyperventilation, it's related to their anxiety. That's obviously going to be on the test. We've said that several times, right? And they have that feeling of suffocation. You don't want to lay back if you're feeling like you're suffocated, right? So make sure you're sitting that patient up with all of these. And then asthma, you're going to hear that wheezing. Differential diagnosis, peripheral edema and cyanosis. Heart failure and severe asthma both can be associated with cyanosis. So I want you to know that for your exam. And then edema you'll see with renal disease, varicose veins, and pregnancy. Paresthesia of the extremities. You're going to see that in hyperventilation and is less common with asthma and heart failure. So this is going to help you differentiate between asthma and heart failure. The use of accessory respiratory muscles, asthma, you're going to see that in asthma and possibly with the acute pulmonary edema. Chest pains, you're going to see weight and pressure, shooting or stabbing feeling with hyperventilation, and pre-existing heart failure concurrent with myocardial infarction. Heart rate and blood pressure increases during respiratory distress, asthma and hyperventilation as a result of anxiety. Blood pressure and heart rate increase during heart failure, diastolic usually elevated to a greater degree. Remember, it's going up 10. Every time it goes up 10, it increases by 30%. The duration of respiratory distress, heart failure improves dramatically with repositioning. Pulmonary edema does not improve until definitive care is managed. Asthma is pretty quick once they have their albuterol inhaler. And hyperventilation, no drug intervention is necessary. You're just going to have the cupping of the hands and breathing in and out slowly.